So summer is here, and one of the most common questions that I get asked in the office and on social media is how to treat keratosis pilaris, or chicken skin, or strawberry skin. And so today we're going to be talking about how to tackle the topic of keratosis pilaris, so stay tuned. Hi everyone, my name is Dr. Degha Fongod. I'm a cosmetic physician in the DC metro area, and on this channel I like to talk about skin and health topics that affect people of color. So let's talk about keratosis pilaris. Keratosis stands for excessive skin, and pilaris basically stands for hair or hair follicle. And so keratosis pilaris is excessive skin around the hair follicle. Now, who gets keratosis pilaris? KP will affect men and women equally. Typically, you'll start to see it around age of puberty, and usually it slows down around age 30, but for some people, it might persist into their 40s and 50s. It's also associated with eczema or atopic dermatitis and type 2 diabetes. Why is there construction right now? Okay. People who have KP will normally notice that the skin in these areas might be a little bit bumpy because, again, you have that excessive keratin around the hair follicle, which creates that chicken skin type of sensation. Okay, so it's bumpy, it's textured, it's a bit rough. For other people, they might notice that the area actually is red. So you might have erythema or redness around the hair follicle for lighter skin individuals. And for darker skin individuals, you might notice brown or black spots around the hair follicle. So you'll just notice that you have a lot of black dots everywhere on your leg or in your arms, and that is significant. That is characteristic of keratosis pilaris. In terms of what causes it, we know that keratosis pilaris has a genetic component to it, so it runs in families. The exact cause of it is really not known. We also know that it's associated with atopic dermatitis or eczema, and it's also associated with type 2 diabetes. And the theory for this one is that when you have hyperinsulinemia or insulin resistance, it tends to trigger the production of androgens, and androgens will then trigger the hyperkeratosis. And so when you have excess skin production and you have a difficulty with exfoliating the skin, then you tend to get those little bumps around your hair follicle. So that's a theory. And so with that theory, that's gonna guide us in terms of how we approach treating it. So the first thing that we're gonna do is we're gonna try using products that are gonna help to exfoliate the skin. So AHAs, which are alpha hydroxy acids, such as lactic acid and glycolic acid, will be great for helping to exfoliate the skin and to increase cell turnover. And also, we could use salicylic acid, which is a beta hydroxy acid, to also help with exfoliating the skin. The next group of products that we recommend for keratosis pilaris is urea-based products. So anything that is higher, 10% or more of urea. Urea acts as a keratolytic product agent at higher concentrations. And so what that means is it's going to break down that skin, that excessive skin around the hair follicle. And so urea-based products are also going to be great for helping with exfoliating that excessive skin. And I will have product recommendations below, okay? So first, we're using AHAs, we're using BHAs, and we're also using urea products. Another class of products that would be great for exfoliating the skin will be retinoids. And so if you have tretinoin, for example, or if you can get an over-the-counter retinol such as adapalene, then using these retinoids in these areas will help with increasing the cell turnover, and that's going to also exfoliate the skin. And it's actually going to help with some of that redness and inflammation in the skin that some people actually experience. So with the use of AHAs, BHAs, and retinols, you want to make sure that you really use a good moisturizer to make sure that your skin doesn't stay dry, because when you have dry skin, then there's a good chance that you might actually get itchy. And if you scratch your skin, then you're going to inflame your skin. And then if you have inflamed skin, that can also lead to redness and sometimes hyperpigmentation. So it's kind of like a vicious cycle. So you want to make sure that you stay on top of it. We also use other medications in the office. So if you come to the office to see a physician, we might prescribe some medications. But for now, the ones that we mentioned are great over-the-counter options for you. So earlier I mentioned that this condition is associated with type 2 diabetes and specifically insulin resistance. So if we know that insulin resistance plays a role in this, then your nutrition is going to be really important in helping to improve this hypokeratotic state, right? So it's important to make sure that you're eating a very clean diet. If you have some weight to lose, then obviously weight loss would be really important in treating this particular condition. So now that we've talked about how we tackle the excessive skin component, let's talk about the hair. So one of the ways to actually improve KP is to actually remove the hair completely. And so we recommend laser hair removal because not only does it remove the hair, but it also slows the growth of hair. And if there's no hair on your skin, then there is nothing for that excessive skin to anchor itself onto. So laser hair removal is actually a really great treatment option for keratosis pilaris. Waxing and shaving, however, are not the best things because they can actually promote inflammation as well on the skin, which can then cause PIH, which is something that we're trying to avoid. So if you can afford laser hair removal, it's definitely a great option for helping with keratosis pilaris. And in the office, we also have chemical peels that are higher percentages of AHAs and BHAs that we can use to help exfoliate the skin and remove that excessive skin around the hair follicle. I want to conclude by saying a lot of people struggle with KP, and some of my patients have told me that because of KP, they don't wear shorts, they don't wear short sleeves, they wear long sleeves just to cover up because they feel really self-conscious about it. And I want to say that you shouldn't let skin conditions stop you from living your best life. It's really important that if you have this condition and you're going to expose these areas to the sun, that you make sure you're wearing sunscreen, because again, UV rays will cause further inflammation to the skin, and that can lead to either erythema or redness and irritation to the skin, and it can also cause hyperpigmentation in those who have darker skin. So I hope this video was helpful. If you're in the DC metro area and you're looking for a place to get laser hair removal or chemical peels for this particular treatment, then I'll leave my information in below. But until next time, I'll see you on the next video. Bye.